An outbreak of the deadly Nipah virus in West Bengal is raising alarm across Asia, with several countries stepping up health screening measures. At least 2 confirmed cases have been reported, all linked to a private hospital. Among the infected are healthcare workers. According to state health officials, more than 100 contacts have been quarantined as authorities race to contain the spread. Let's break this down further. The Nipah virus was first identified during an outbreak in Malaysia in 1998. It's a highly fatal zoonotic disease transmitted from animals like fruit bats and pigs to humans. And in some cases, it is from person to person. It has a mortality rate ranging from 40% to 75%, with no approved vaccine or treatment. The World Health Organization has described Nipah in its top 10 priority diseases, along with pathogens like COVID-19 and Zika. This is mainly because of its potential to trigger an epidemic. And the incubation period ranges from 4 to 14 days. People who contract the virus show a wide range of symptoms or sometimes none at all. Initial symptoms may include fever, headaches, muscle pain, vomiting, and sore throat. In some people, these may be followed by drowsiness, altered consciousness, pneumonia, and brain inflammation. In response, countries including Thailand, Nepal, and Taiwan have introduced or proposed stricter screening and surveillance measures. No cases have been reported outside India. Authorities say vigilance, early detection, and public awareness remain key as the situation continues to develop. There is public concern in China ahead of the Lunar New Year holiday when millions will be traveling. The Chinese health experts are saying it is difficult to transmit and less likely to cause an outbreak in China. A powerful international assessment has reinforced India's position on Operation Sindoor and underscored how the Indian Air Force shaped the outcome of last year's 4-day air conflict with Pakistan. A Swiss military think tank in its report has said India achieved clear air superiority, crippled Pakistan's defenses, and forced Islamabad to seek a ceasefire by May 10, 2025. The detailed study by the Switzerland-based Center for Military History and Perspective Studies says the Indian Air Force dominated large sections of Pakistani airspace during the 88-hour operation. And the study concludes that Indian fighters and strike aircraft operated with near total freedom, while the Pakistan Air Force lost the capacity to launch meaningful counterattacks. Now, the report, authored by military historian, further stating that by the morning of May 10, the Indian Air Force had dismantled key elements of Pakistan's air defense network. Indian strikes hit major Pakistani air bases and radar sites, leaving enemy aircraft exposed and grounded. And the report says this dominance allowed India to conduct long-range precision strikes at will as advanced munitions, such as BrahMos, remained available. And the study confirming that Indian strikes targeted terror infrastructure, including Jaish-e-Mohammed's headquarters in Bahawalpur and Lashkar-e-Toiba's base in Muridke. The Swiss report also stating that over 4 days, Indian air defenses destroyed more than half of Pakistan's drones, while electronic warfare systems jamming played a key role. The report says Pakistan lost its ability to repeat attacks after losing radars and facing the threat of India's S-400 missile systems. And it concludes that by degrading Pakistan air defenses and striking major Air Force stations, India compelled Islamabad to ask for a ceasefire, even as the Swiss report and India's repeated evidence-led proof clearly outlined India's dominance during the Operation Sindoor. Pakistan is continuing with its baseless narratives. At the United Nations Security Council, after Pakistan's envoy claimed there could be no new normal based on coercion, India responded sharply. India's permanent representative there accused Islamabad of diverting attention from cross-border terrorism. Listen to this.
It is not normal to tolerate Pakistan's continued use of terrorism as an instrument of state policy. This hallowed chamber cannot become a forum for Pakistan to legitimize terrorism.
the Indian ambassador warned that the United Nations must not become a platform to legitimize extremism. And while referring to the April 22nd Pahalgam terror attack, he said India's response remained restrained and calibrated, aimed at dismantling terror infrastructure in Pakistan and Pakistan-occupied Kashmir. Britain has quietly repatriated several Islamic State-linked women and children who were held in Syria, including some who were detained alongside Shamima Begum. According to officials at the camp, which is run by the Kurdish-led Syrian Democratic Forces, 6 British women and 9 children have been sent back to the UK reportedly in recent years without public announcements. A total of 29 women and children with current or former British passports remain in the camp near the Iraqi border reportedly. Shamima Begum, remember, left that part in East London in 2015 at the age of 15 to join ISIS. She had her British citizenship stripped and was barred from returning after she was found in detention in 2019. The same policy was later applied to other women after the fall of ISIS' final territory. The 2 other schoolgirls who travelled with Begum are believed to have died during the fighting. While the UK government says its policy has not changed really, a small number of women have been allowed to return with their children on a case-by-case basis. Most of those repatriated were under the age of 18 when they travelled to Syria. Unaccompanied minors were previously allowed to return and were placed with social services, but children who remained with their mothers were kept in the camps. A report last November suggested that 3 adult women and 18 children had been brought back, though only 2 cases were publicly confirmed. Now, it's understood that 2 more families returned in 2024 and 2025. The repatriations come as the security situation in Syria worsens. The Syrian military has moved to end Kurdish control in the northeast, taking over camps and triggering riots, fires, escapes. At a camp where tens of thousands once lived, women and children were left in chaotic conditions as Kurdish forces withdrew, with camps now at risk of collapse and the United States considering a withdrawal from Syria. Experts are warning that the fate of the remaining ISIS prisoners and their families is more uncertain than ever.